Chapter 37, Care of the Surgical Patient by Mrs. Nakia Henderson, RN, BSN. Lesson 37.3, Post-Operative Surgical Care. Theory objective includes to select interventions to prevent each of the potential post-operative complications. Clinical practice objectives. Prepare to perform an immediate postoperative assessment when a patient returns to the nursing unit. Promote adequate ventilation of the lungs during recovery from anesthesia. Assess for postoperative pain and provide comfort measures and pain relief. Promote early ambulation and return to independence in activities of daily living. Perform discharge teaching necessary for postoperative home self-care. Post-anesthesia care unit provides care to patients who have had general anesthesia or spinal anesthesia and/or who require constant observation after a surgical invasive procedure. Patient is positioned to maintain patent airway, prevent aspiration, and is kept warm. Patient is monitored until vital signs are stable and he or she is awake and able to respond to stimuli. If patient is not stable, he or she may go to the ICU. Figure 37-9, Post-Anesthesia Recovery Unit. Vital signs are taken every 5 to 15 minutes until stable. Emergency equipment is on hand. Post-anesthesia recovery period is usually 2 to 6 hours. Patient is kept warm by covering with warmed blankets. The environment is kept quiet. Aldrete scoring system. This scoring system rates a patient's activity, respiration, circulation, consciousness, and skin color on a scale of 1 to 3. A total score of 9 or 10 usually indicates the patient is ready for transfer. Post-anesthesia care in the same-day surgery unit. Monitor the patient's respiration, circulation, vital signs, neurologic status, fluid balance, wound drainage and dressings, and comfort level. When the vital signs are stable, the patient can sit up and begins to ambulate. When able to ambulate unassisted, the patient may be discharged if vital signs are also stable. Recovery time in the same-day surgery unit takes about 1 to 4 hours. Discharge patient education begins preoperatively and continues once patient is again alert. Written instructions are always sent home with the patient. Post-surgical care on the surgical floor. On receiving patient from PACU, perform baseline assessment. Monitor vital signs every 15 minutes for first hour, every 30 minutes for next 2 hours, every hour for 4 hours, or until patient is totally recovered and vital signs have returned to normal. Post-operative assessment. Lung sounds, respiratory rate every 15 minutes, assess quality of respirations and oxygen saturation. Auscultate the heart sounds, check peripheral pulses and sensation, skin color. Do this initially Q4 hours times 2, then with each vital sign check. Check level of consciousness and orientation with vital signs check. Full vital signs upon reception and every 8 hours once stable, and per policy at the facility that you are employed. Postoperative assessment continued. Monitor IV site and IV flow rate. Monitor INO, skin turgor, and oral membranes. Check surgical site for bleeding, drainage, integrity of dressing, and drainage systems if in place. Auscultate bowel sounds, assess abdomen, check NG drainage color, character, and amount. Check patency of all tubes inserted in patient. Assess urine output quantity and characteristics. Monitor patient's pain utilizing pain scale and observing nonverbal behaviors. Safety measures. Ensure side rails are up until patient is fully alert. Bed is in low position. Orient patient to surroundings, and call light is in place. Expected outcomes. Maintain a patent airway, maintain tissue perfusion, promote rest and comfort, promote wound healing, promote psychological adjustment to lifestyle or body image changes, and prevent complications. Possible postoperative complications. Atelectasis, which is partial collapse of a lung or a section of a lung. Pneumonia, which is an infection that inflames air sacs that may fill up with fluid. There are 3 types of pneumonia. Aspiration, due to inhaled material from stomach or mouth. Hypostatic, caused by pulmonary congestion due to the stagnation of blood in a dependent portion of the lung. Frequently occurs in patients who are bedridden or elderly. Bacterial, which is caused by bacteria that works its way into the lungs and multiplies. Paralytic ileus, obstruction of the intestine due to paralysis of the intestinal muscles. Thrombophlebitis, blood clots in the veins. Urinary retention, difficulty urinating and completely emptying the bladder. Urinary tract infection, infection of the urinary tract. Wound infection, infection of the surgical site. Pulmonary embolus, clot formation in the arteries of the lungs. Hemorrhage and shock, excessive bleeding resulting in decreased tissue perfusion and inadequate delivery of oxygen and nutrients necessary for cellular function. Wound dehiscence, separation of wound edges. Fluid imbalance, dehydration or overhydration. Preventing complications. Respiratory function, encourage coughing and deep breathing and use of intensive spirometer. Circulation, monitor blood pressure and skin temperature. Encourage activity and leg exercises. Anti-embolus stockings help to promote circulation and monitor pedal pulses. Maintain fluid balance. Monitor for fluid and electrolyte imbalances. Monitor nasogastric tube function and output. Monitor urinary output and characteristics. Promote GI function. Monitor bowel sounds and bowel movements. Promote comfort. Control or prevent pain and discomfort. Encourage activity, dangling, sitting up, ambulation, and prevent infection. See Table 37.5, Postoperative Complications on page 756 for a full list of postoperative complications and associated signs and symptoms and preventive interventions. Commonly used nursing diagnosis for post-op patients. pain related to disruption of tissue, risk for infection related to surgical wound, impaired gas exchange related to the effect of anesthesia on the lungs, ineffective airway clearance related to inability to breathe deeply and cough without discomfort, self-care deficit, bathing related to decreased mobility, tubes and dressings, risk for injury related to sedation, decreased level of consciousness, or excessive blood loss. See page 749 for a full list of nursing diagnoses. Review questions for NCLEX exam. When a patient arrives in the PACU with a surgical dressing, an intravenous infusion, and a urinary catheter, the priority action of the nurse is assessment of number 1, urine output, number 2, IV line patency, number 3, airway patency, number 4, wound drainage. As part of patient's immediate care in the PACU, the nurse would, and please select all that applies, number 1, check vital signs every 15 minutes, number 2, assess adequacy of respirations, number 3, monitor the dressing, number 4, observe the drainage from the NG tube, number 5, note the amount of urine output. A patient returns to his room after surgery. When he arrives, you notice that he is still groggy from anesthesia and that he has an IV running in one arm. As you help settle him in bed, you and select all that apply. Number 1, assess the IV for patency and correct fluid and rate. Number 2, position to prevent aspiration while still groggy. Number 3, quickly medicate for pain. Number 4, take his vital signs every 15 minutes for 1 hour. Number 5, reassure him that the surgery is over. Question 1. Angela is assessing her post-op patient for bowel sounds. Eating is not allowed until bowel sounds return because of the risk of number 1, aspiration, number 2, paralytic ileus, number 3, pulmonary embolus, or number 4, pneumonia. The end.